Hi, I'm Pat Doughety. I'm a chiropractor in Spokane, Washington. I'm going to talk to you today about a very important supplement, a vitamin that I think is the most important supplement that anybody can take. It's a vitamin that almost everything that is known about it, some experts say 99% of everything we know about this vitamin has been discovered this century. It's also a vitamin that is very unique. As a fat-soluble vitamin, it's actually a hormone. A hormone is a chemical messenger. It darts around the body and it hooks into cells and leaves messages at those cells that help the cell work at a higher efficiency rate. Now, it just so happens that this vitamin hooks into between 2,000 and 3,000 genes in your body, and when it does that, it causes them to work better. No other vitamin does this. Consequently, this vitamin is found to be deficient in a huge number of named diseases and conditions. It's also a vitamin that, being fat soluble, some people have a very hard time getting it into their system. This vitamin is vitamin D, the sunshine vitamin. Now, some people believe that all you got to do is be out in the sun and you'll have vitamin D. And all the sun does is give us the capacity to synthesize vitamin D. We don't get vitamin D from the sun. But it's really, really hard, they found, to synthesize enough vitamin D when you get into the northern climes. Down at the equator, vitamin D deficiency is much less. Consequently, diseases like multiple sclerosis are much less down at the equator. But even up here in Washington, they've done studies that show even people who are like triathletes, who are out all the time, they're running and swimming and biking, are vitamin D deficient. So what are you going to do about that? You almost have to supplement. And a decade ago, it was widely acknowledged that if you take 400 IUs, international units of vitamin D a day, that should be plenty. In the last 3 or 4 or 5 years, it's gone from that to about 2,000, up to 3 and 4 and 5,000, and now some of the best medical schools like Harvard, George Washington, Stanford are saying people need to take 10,000 IUs of vitamin D a day, especially in the winter, and maybe drop back to 5,000 a day in the summer. And from our personal experience here, using vitamin D for about 3 years, supplementing it to our patients, we find that those people who get tested end up no better than in the middle range of vitamin D at 5,000 IUs a day. So why is vitamin D so important? I'm going to read you the results from some studies. This one from the Virology Journal in 2008, an article by 16 experts states that flu might well be a dormant disease that becomes active when a person is vitamin D deficient. And this would explain why flu is so seasonal, although it's becoming less seasonal as the years go by. We're tending to see flu in almost every month anymore. Another one, vitamin D and its role in cancer prevention, in the American Journal of Public Health states, evidence supports that efforts to improve vitamin D status, for example by supplementation, could reduce cancer incidence and mortality at low cost with few or no adverse effects. In the Trends in Endocrinology and Metabolism journal, they write that high-dose vitamin D supplementation early in life protects against type 1 diabetes. This means that kids need vitamin D. Vitamin D is one of the greatest protective mechanisms that a kid can have. Vitamin D deficiency in pregnancy probably increases the incidence of autoimmune diseases such as type 1 diabetes in genetically predisposed individuals. Here's one from the American Journal of Clinical Nutrition that states, the suggested daily dose of 3,800 IUs for those with adequate vitamin D levels and 5,000 IUs each for those each day for those who are vitamin D deficient. And that's from way back in 2008. It's gone up since then. Here we have another study. No, actually, that's it for the studies. So what I want to tell you is it matters what kind of vitamin D you take. That's why I choose to carry a vitamin D that's liquid, because it is a fat-soluble vitamin. The liquid form for people who have fat metabolism problems, which would be everybody who's had their gallbladder taken out, everybody who has gallbladder problems or liver problems, is much more likely to get in the system, be utilized. And so I carry this $26 a bottle. At 5,000 IUs a day, this bottle would last one person over 5 months. So that comes down to about 16, 17 cents a day for a vitamin that will optimize the function of 2,000 to 3,000 genes and countless other cells. And a vitamin that is found to be deficient in people with a laundry list of named conditions and diseases. That's why I tell everybody in our office, you'd be crazy if you don't take vitamin D. Again, this is Pat Doughety. I'm a chiropractor in Spokane, Washington. My phone number is 509-327-4373. Web address, www.spokane-chiropractic.com. Thanks for your time.